Hello, welcome back to the answer portion of Ask Dr. Dan. This week our topic was ultrasound. So the first question, is ultrasound better than MRI? The answer is they're both good and better for certain things. So MRI is really good to look at whole areas like a whole knee or a whole ankle, shoulder. Also, it can show what's going on underneath the bone. So one of the limitations of ultrasound is you can't see past bone because the bone is too dense. Where ultrasound is really good diagnostically is you could see very specific areas, and you can also use the ultrasound dynamically, where the MRI, the person's just sitting in the machine. With the ultrasound, you can move the joints. So where a tear that might be completely like this opens up as you move, and you can see a tear on ultrasound that may be missed on an MRI. So they both have their goods and their bads. The other really important thing with ultrasound is you can also do procedures right then and there. So if you see something with the ultrasound, you can then do an injection right in the office. And also you're getting an immediate answer, where I do it in my office and I could see exactly what's going on. If I send someone for an MRI, it might take a week or two for an answer to get back to me. So overall, there are certain things that the MRI is better for, but many things the ultrasound can be used to diagnose. The second question is using ultrasound or fluoro better for injections? Again, it's one of those questions where I think they both have their strengths and weaknesses. So fluoro is using an X-ray in real time. I think fluoro is definitely the better modality for going inside the spine. So for doing things like epidural injections or into the disc areas, I really would not recommend using an ultrasound. I think the fluoro is a much better machine. Where the ultrasound I think is much better is in things like the peripheral joints, like the knees and the shoulders and the elbows. What you can't see on fluoro, it's just an X-ray, so you can see bones, but you can't see the tissues, so you can't see the joint space, you can't see the muscle, you can't see if there's a nerve or a blood vessel in your way. So you can damage one of those structures using a fluoro for certain injections. Also, with the ultrasound, you could do things like muscle injections, tendon injections. You can inject around a nerve using ultrasound, which you cannot do on fluoro. With fluoro, they're just basically using the landmarks, where ultrasound you can actually see exactly the different tissue textures and where you are. So I think for most things outside of the spine, I would say ultrasound is the better of the two, but for in the spine, I think fluoroscopy is a better treatment. So the third question, why are ultrasound procedures better than surgery? So for the procedures that can be done through ultrasound, the reason that I prefer doing that is because instead of making a big incision and then having to go all the way down and cut through muscle and different tissues to get to where you need to go, with ultrasound you could do it through a minimal incision like this, and just with a needle guide down into that area. So you're not disturbing the good tissue to get down to the bad tissue. And you can still remove the tissue for something like tennis elbow or Achilles tendonitis or plantar fascia just as well. Then you can do it openly, but much less complications, less likely to get things like wound infections. And again, you're not damaging that muscle to get down there. So that's why I think for things you can do ultrasound guided, it's a better procedure. And then the last question, it's a good question, is if ultrasound's so good, why don't all doctors do it? And the answer is ultrasound takes a lot of training. So for musculoskeletal ultrasound, you really have to do thousands of hours to get good at it. When you're looking at ultrasound, what you're seeing, that image, is actually only the size of a credit card. So to guide a needle, you have to be right within that credit card width, or else you don't see anything. So that takes a lot of training to be able to use the ultrasound and to do the procedures at the same time. So some people just are not trained to use that. So and then even some people that do use ultrasound don't have all the training that they should to do those types of procedures. So that's why I think ultrasound isn't used by everybody. So again, if you have any other questions on ultrasound, you can write to us on any of our social media platforms, at Facebook at Apex Center for Regenerative Medicine, on Instagram at RegenerateNJ, and please subscribe to our YouTube page at Apex Center for Regenerative Medicine, where we are constantly creating more videos and answering all of your questions. Remember, have a great holiday weekend, and don't operate, regenerate.